If you believe that you might have ADHD because you're a lot more active and impulsive than other people around you, then you came to the right place. I have a little test for you, after which you will have a good indicator on whether you do or do not have the hyperactive and impulsive subtype of ADHD. For those of you who don't know me yet, my name is Arije. I have a MA in Education Studies. I offer coachings to neurodiverse individuals, and I'm a dyslexic myself, and I probably also have dyscalculia. Now, for the creation of this video, I used the DSM, which is where you can find the official criteria for a ADHD diagnosis. So we're going to start with a couple of questions, and if you are below the age of 17, you will have to answer yes at least 6 times. If you're older than that, you will have to answer yes at least 5 times. Now, towards the end of the video, there are going to be some additional criteria that also need to apply to you. And also, I would like you to keep in mind that this should not be a replacement for an official diagnosis. So that being said, let's get into it. Question number 1. Do you often move your hands or feet in a restless manner? Or do you often fidget in your chair? Maybe this is something that you regularly do with a pencil. The next question is, do you often feel restless? People with this subtype of ADHD often have a hard time to relax. And now question number 3. Do you find it difficult to await your turn? This might be something you struggle with when you have to stand in line. The next question is, do you find it difficult to engage in leisure activities quietly? For example, you might find it hard to remain silent when it is not really appropriate to talk. Question number 5. Are you often on the go? Or do you often act as if driven by a motor? People might tell you, you just have too much energy. Do you often answer questions before they actually have been completed? Some people might find this a little bit tactless, and you're probably aware of this, but at the same time, you can't always help yourself. Do you often stand up in situations where the expectation is that you remain seated? Overall, you might prefer walking rather than sitting. Question number 8. Do you often talk extensively? Meaning, do you talk a lot? And question number 9. Do you often interrupt the activities of others? And those people might find it kind of disturbing when you do so. So these are the 9 symptoms of the hyperactive and impulsive subtype of ADHD. Now, there are 4 more criteria that are not optional, meaning they have to apply to you as well. And the first one I'm going to read to you. There's clear evidence that the symptoms interfere with or reduce the quality of social, academic, or occupational functioning. So if you experience these symptoms just every once in a while, then that wouldn't be enough for an official diagnosis. Now, the next criteria states that the symptoms have to be present in more than one life domain. So, for example, at home and at work. For the next criteria, we need to ask ourselves the question, are there other different conditions that could explain our symptoms better than ADHD? Here are some conditions that regularly get confused with ADHD. And when you're in doubt, it's always worthwhile to consult with a professional. And for criteria number 4, we need to make sure that several of these symptoms were present before the age of 12. A good way to check this is by sending this video to a family member and simply ask them, do you think I experienced these symptoms when I was a kid? If you got distracted a lot while watching this video, if you had to rewind a lot because you just weren't able to focus, then maybe you have actually the inattentive subtype of ADHD, and you can check that out by clicking on this video. Thank you for watching, and see you in the next one.